Hi, my name is Cynthia Wang, and this is my analysis of South Korea's COVID-19 outbreak. So I first started with infections per day. How I did this was I just looked at the symptom onset date. This is just a more accurate representation of when the patient was infected. And then I graphed this against the number of infections for that day. And so I looked at age per infections per day, and you can see that 20-year-olds, 30-year-olds, and 40-year-olds were the highest in number of infections. And so this just makes sense because they are typically those who are working, who are moving around, so they are more likely to get infected. Then I looked at infections per day by sex. As you can see on the graph, there's a very large increase in infections, and during that period, females almost double in amount of infections than males. And throughout the graph, you can see that they are typically higher than males. And then I looked at infections per day by province, and you can see in this graph that the province of Seoul and Gyeonggi-do have a lot of the infections per day. And this is because they are the most populous provinces within South Korea. So that means they're more likely to have people come in contact with each other. This is also where patient 31, which I'll talk about more later, was located. And so this is probably why there are more number of infections in this area. Then I looked at whether government interventions were successful. I used the same graph of number of infections per day and just create a timeline of certain things that the government intervened with. And so you can see right here that this is when patient 31 was tested, and that's prior to this is probably when people started to actually get infected. And a few days later, the South Korean military bases were locked down because there were quite a few cases there, and then travel started to be suspended and schools were closed. And during this time, that's when number of infections peaks, but then afterwards it starts to decrease. And this is when they start to ban or limit countries from entry. And then towards the end of this is when they threatened to shut down churches, just because churches were where a lot of the infections were actually occurring. And so the government interventions seem to have some sort of impact on the amount of infections, or at least like decreasing the amount of infections, because after this peak it seems to go down, and that's right before they shut down a lot of the public spaces. And then I looked into significant factors in mortality rate. I did this by just separating the people who died from COVID-19 on the data frame into a separate data frame. And so the approximate mortality rate in South Korea for this disease is 1.99%. And so these are the corresponding deaths. And so you can see that the percentage of deaths per age group right here is that people who were older were more likely to die from this disease. And so from 50s onwards, you can see that the percentage of deaths increases for those groups. And this makes sense because they are just more prone to getting the disease and also having underlying conditions. And then you can see right here the percentage of deaths per disease. And so right here you can see that most 64.2% of them did not have a underlying condition, but 35.8% did. And so this still plays some factor into it, but age seems to be a bit larger factor. And then there is percentage of deaths per sex. And this was interesting because 67.9% of the deaths were male and 32.1% were female. And this makes sense because males are known for having a shorter lifespan, and so this could tie into this factor. And so these are 3 things to be aware of when trying to prevent this disease. And then I looked at superinfectors. Superinfectors are just the individuals who infected many of the other patients within this data set. And so I looked at the infected by field and matched those accordingly with the infector. And shown right here is just the top 10 infectors. The biggest superinfector infected 46 people that we know of, and 4 out of the 10 superinfectors infection cases were contact with a patient. So this just shows that those who are working within the medical field are more likely to contract the disease and also spread it. Others within this top 10 are infection cases were a gym facility, which makes sense because there's a lot of ways you can exchange fluids within that space. And then there's also church listed. If you look at the total infectors, many of them are their infection cases are from churches, and that corresponds with information from the news saying that a lot of the infections were found within churches. And then I looked at the infectors and the number of people infected. And so the percentage of infectors, most of them only infected 1 person. The superinfectors were part of a group of outliers for the most part, but it's still something to be aware of because even though most of them only infected 1 person, that person could have infected another. And then I looked at the symptom onset dates for the infectors, and none of them had listed symptom onset dates, which is something to be aware of because this could mean that the infectors were asymptomatic or just not aware of their symptoms, which would mean that they are more likely to continue to expose others to the virus. In the case of the number 1 superinfector that was shown earlier, who infected 46 others, this could be the case where they didn't know they were infected by someone and they continued to spread it. And especially since they worked within a medical field, they were more likely to spread it. So this is definitely something to look at. And then lastly, I looked at patient 31, and she was part of the top 10 infectors. But what was interesting was when the number infected was graphed against number of contacts. And so she had a much larger number of contacts than the number infected on the data frame. And so this could mean that the number infected is vastly underestimating how many people were actually infected. If she had contact with this many people, that means there are probably a lot more infections, and that those infections were probably not diagnosed. And so this is something that should be taken into consideration when they are looking into total number of infections within their country. Yeah, and so those are my findings. And you can see right here, this is just a timeline of patient 31's infection. And so you can see that she spent a lot of time traveling prior to being tested. And then lastly, these are the sources I used. Thank you.